Your blood type predicts how you die. The truth about longevity. Consider a moment of uncomfortable introspection. If your physician were to gaze upon you today and armed with an unparalleled understanding of your unique biological blueprint, articulate the single most statistically probable manner in which your physical form would begin its decline after the age of 60, would you genuinely wish to receive that information? Overwhelmingly, most individuals would unequivocally affirm their desire to know, yet paradoxically, they would then proceed, often for the ensuing decade, to systematically disregard the very insights and actionable knowledge that could, with diligent application, entirely prevent or significantly mitigate the predicted trajectory. This pattern is not merely anecdotal, it represents a profound and recurring observation after countless years dedicated to the intricate field of preventive medicine. What stands out as truly remarkable in this context is the existence of a singular, profoundly impactful piece of biological data that every single person within this nation has possessed since the very moment of their birth. This critical indicator typically resides on a humble card tucked away in a forgotten drawer, or perhaps buried within a faded hospital form dating back 3 decades, representing one of the most fundamentally underutilized biological predictors we possess for understanding and anticipating complex age-related disease patterns. This invaluable piece of information is, of course, your blood type. However, it is imperative to clarify that this understanding transcends the superficial interpretations often found in popularized diet books or the fleeting pronouncements of wellness influencers. Instead, we refer to the profound insights gleaned from rigorously conducted, peer-reviewed epidemiological research, studies that have meticulously tracked hundreds of thousands of patients over multiple decades, increasingly illuminating how your specific blood group leaves an undeniable and measurable fingerprint on a multitude of vital physiological processes. This fingerprint dictates, with startling statistical clarity, how your cardiovascular system will age, how your brain will maintain its resilience and cognitive function under the inevitable pressures of life, how your intricate immune system will react and behave when confronted by various challenges and pathogens, and indeed, what statistical pathways are most likely to culminate in significant health challenges or premature mortality if proactive early interventions are not conscientiously implemented. Today, we embark on a comprehensive journey through each of the primary blood types, O, A, B, and AB, and for every single one, I will unveil insights that most physicians, through no fault of their own, rarely have the opportunity to share during a routine checkup. This omission is not born of secrecy, but rather from the severe temporal constraints inherent in a typical 15-minute appointment, which simply does not afford enough time to connect these intricate biological dots for you. I will endeavor to do so right now, but I urge you to remain engaged until the very conclusion of this exploration, for there exists a crucial modifier, an additional layer of biological information that overlays every primary blood type, extending far beyond the simple letter designation on your card. This modifier dramatically alters your personal risk profile in ways that most individuals have never once considered, despite its profound significance. But before we delve further into these revelations, I invite you to share your blood type in the comments below. O, A, B, or AB. Knowing yours will render the ensuing discussion far more personally relevant and impactful. Let us commence our detailed examination with the type O blood group, and I intend to present this information from a perspective that you may not have previously encountered. Type O is notably the most dominant blood type across the globe, with approximately 45% of the human population carrying it. For the vast majority of human history, this prevalence was undoubtedly an enormous evolutionary advantage, playing a pivotal role in the survival and proliferation of our species. Type O blood is believed to have emerged within our earliest ancestral populations, its characteristics meticulously shaped by environments that relentlessly demanded exceptional physical endurance. the capacity for an incredibly robust and efficient immune response to prevalent parasitic infections, and a highly adaptable digestive system capable of processing substantial quantities of animal protein, often under conditions of considerable environmental stress and scarcity. The crucial question, then, is what this ancient, deeply ingrained biological blueprint looks like when manifested within a modern human body, particularly as it navigates the physiological shifts that occur after the age of 60. On the cardiovascular front, type O individuals typically exhibit lower circulating levels of von Willebrand factor, a glycoprotein that plays a critical role in the complex process of blood clotting. This reduced clotting activity translates directly into a smoother, less impeded blood flow throughout the circulatory system, a decreased propensity for platelet aggregation, and consequently, a statistically significant lower risk of developing the arterial blockages that are the primary culprits behind heart attacks and ischemic strokes. Multiple extensive, large-scale studies have consistently confirmed that individuals with type O blood carry a meaningfully lower risk of coronary artery disease when compared to the combined risks of those with A, B, and AB blood types. This indeed represents genuinely good news, a remarkable protective inheritance. However, here lies a critical caveat, a truth rarely communicated to type O men and women as they pass the age of 50. This inherent cardiovascular advantage, as potent as it is, can inadvertently transform into a dangerous psychological trap. I have observed this insidious pattern unfold countless times in my practice. A type O patient, typically in their late 50s, presents for a consultation. Their blood pressure is well within healthy parameters, cholesterol levels are manageable, and there is no concerning family history of heart disease. Because they possess this structural biological protection, a sense of complacency often sets in, leading them to cease paying meticulous attention to other vital bodily systems that are, unbeknownst to them, quietly undergoing erosion. They might dismiss persistent fatigue as a normal part of aging, ignore recurring digestive complaints, or simply push through chronic joint pain. The reason for this oversight is profound. Type O's most serious age-related vulnerabilities, the ones that truly demand proactive vigilance, do not typically originate from the heart itself. Instead, they emanate from the region below it, specifically the stomach. The stomach lining of a type O individual expresses unique surface receptors that the notorious Bacterium Helicobacter pylori finds, quite frankly, significantly easier to attach to and colonize than in any other blood type. H. pylori is not a pathogen that announces its presence with dramatic, acute pain in most individuals. Rather, it moves in silently, establishing a persistent colony within the gastric mucosa. Over a period spanning years and even decades, it gradually and insidiously breaks down the stomach's crucial protective lining. If left undetected and untreated, this chronic colonization creates a slow yet inexorable escalation from chronic gastritis to the formation of painful peptic ulcers, and tragically, in a meaningful percentage of cases, to the development of gastric cancer. Gastric cancer, when diagnosed at a late stage, is unfortunately one of the most challenging forms of cancer to treat successfully. Furthermore, there is another critical observation. Type O individuals demonstrate a measurably elevated risk for certain peptic ulcer complications that necessitate urgent surgical intervention, a risk notably higher compared to other blood types. This is not mere speculation. It is a well-documented and robust finding in medical literature. Therefore, if you identify as type O, are over the age of 55, and have never undergone testing for H. pylori, initiating that conversation with your doctor this year represents the single most important proactive health step you can take. The test itself is straightforward, typically a simple stool antigen test or a breath test, and it is inexpensive. For type O individuals, this is not merely routine caution, it is targeted prevention, meticulously aligned with your specific biological biological predispositions. Your Type O longevity protocol, therefore, centers on a fundamental principle. Your gut is your primary vulnerability, and it demands active, consistent, and deliberate protection. This mandate includes, but is not limited to, judiciously limiting the long-term use of non-steroidal anti-inflammatory drugs, NSAIDs such as ibuprofen and aspirin, unless their use is deemed absolutely medically necessary. These drugs are known to erode the gastric lining in everyone, but in Type O individuals, they exert their damaging effects on tissue that is already operating at a higher inherent biological risk. Furthermore, consistently incorporate a variety of fermented foods into your regular eating patterns. Kefir, miso, kimchi, and naturally fermented pickles are not just trendy dietary extras. For Type O individuals, they serve as profoundly practical and effective tools for maintaining a gastric environment that is more resilient to bacterial colonization and less prone to the inflammatory cascades that H. pylori can initiate. From a physical activity perspective, your body, by its very design, was built for consistent and robust movement. Type O blood is strongly associated with higher baseline catecholamine activity, meaning your nervous system inherently operates with elevated levels of dopamine and norepinephrine compared to other blood types. While this provides a natural drive, when this abundant energy lacks a regular physical outlet, it readily converts into debilitating restlessness, profoundly disrupted sleep patterns, and over time, a pervasive dysregulation of cortisol, your primary stress hormone. A consistent regimen of 30 minutes of daily brisk walking combined with 2 dedicated sessions of resistance training per week will yield more significant long-term benefits for your metabolic health and overall longevity than any complex supplement stack could ever hope to provide. To summarize, for Type O, cardiovascular strength is your biological inheritance. Your stomach is your profound responsibility. Do not permit the inherent protection of the former to foster complacency regarding the critical vigilance required for the latter. Transitioning our focus, we now turn to Type A blood, and I particularly urge you to lean in closely here, as this represents the blood type where the divergence between what people generally understand about their health and what they critically need to understand is arguably the most pronounced. Type A is believed to have emerged significantly later in human evolution, coinciding with the pivotal transition of human populations toward more settled agricultural lifestyles. This shift brought about denser human settlements, the development of more complex social environments, and an increased exposure to a broader and more diverse range of infectious agents. The immune system of Type A individuals adapted exquisitely to these new pressures, developing the capacity to mount aggressive and highly effective immune responses, particularly against viral pathogens. In the earlier decades of life, this finely tuned immune prowess is an undeniable biological asset, offering robust protection. However, this is precisely where the nuanced narrative of blood types becomes more intricate and, in some respects, more challenging. The very biological mechanisms that conferred protection and advantage in your 30s and 40s can, by your 60s, begin to exert detrimental effects in fundamentally different ways. Type A blood inherently carries higher coagulation activity. This means the platelets within Type A blood are notably stickier, and the proteins involved in the complex clotting cascade are more persistently active. A landmark Harvard study, meticulously tracking 9,500 adults over a span of 2 decades, unveiled a significant finding. Type A individuals carry a 5% elevated risk of coronary heart disease when compared to Type O individuals. While this percentage might appear modest in isolation, its clinical significance for Type A individuals specifically is amplified dramatically when another critical factor is layered on top: chronically elevated cortisol. The compounding effect of this stickier platelet activity combined with sustained high cortisol levels accumulating over decades is what subtly but inexorably transforms a seemingly small 5% statistical difference into a very real and tangible cardiovascular event. The true risk for type A individuals is not merely embedded in this statistical number. It lies in the relentless impact that their specific stress biology exerts on that number every single day, year after year. Now let us delve into a layer of understanding that most discussions on blood types entirely overlook, yet it is profoundly important. The reason this particular cardiovascular risk is so significant for type A is not solely mechanical, it is also deeply hormonal. Type A individuals consistently maintain the highest baseline cortisol levels of any blood type. Cortisol, often termed your primary stress hormone, is, in short, intermittent bursts, exceptionally useful. It sharpens focus, mobilizes glucose rapidly, and primes the body to effectively contend with acute challenges. However, when cortisol remains chronically elevated, persisting week after week, month after month, year after year, it enacts a very specific and damaging process on your arterial health. It actively inflames and stiffens the endothelium, which is the delicate inner lining of your blood vessels. And here lies the critical mechanism that should genuinely concern every type A man or woman who is absorbing this information. When your endothelium is persistently inflamed and loses its inherent elasticity, it transforms into a prime surface to which those already sticky type A platelets preferentially adhere. Thus, the elevated coagulation activity inherent to type A blood and the chronic cortisol-driven endothelial inflammation characteristic of type A physiology are not merely two distinct and separate risk factors. They are, in fact, components of a mutually reinforcing compounding cycle where each factor exacerbates and renders the other more dangerous. What this profound understanding practically implies is that for type A individuals, the active and consistent management of stress is not merely a wellness preference or a benign suggestion. It is unequivocally direct cardiovascular medicine. It belongs in the same critical category as diligently taking blood pressure medication or meticulously managing cholesterol levels because, physiologically, it addresses the exact same underlying pathways of cardiovascular disease progression. If you are type A and have surpassed the age of 55, monitoring your blood pressure readings every 6 months rather than the conventional annual checkup is not an act of excessive caution. It represents entirely appropriate and targeted clinical monitoring for your specific biological profile. Furthermore, explicitly ask your doctor to include homocysteine in your next blood panel. Homocysteine is an amino acid that, when present at elevated levels, actively damages arterial walls. Type A individuals have a discernible trend toward higher homocysteine levels, and the intervention to mitigate this is remarkably simple and accessible, ensuring adequate intake of folate, vitamin B12, and vitamin B6. These essential nutrients are readily found in nutrient-dense foods such as dark leafy greens, eggs, legumes, and lean proteins. This approach is neither expensive nor overly complicated, yet it is highly specific and crucially beneficial for your type A biology. Moreover, cultivate and commit to a daily cortisol reset practice. This is not about an occasional weekend retreat or an infrequent meditation session. It demands something you perform every single morning consistently before the demands of the day have an opportunity to seize control of your nervous system. Diaphragmatic breathing, the measured inhalation for 4 seconds, followed by a prolonged exhalation for 6 seconds, practiced consistently for just 10 minutes, has been shown in clinical studies to produce measurable and significant effects on cortisol regulation. The paramount factor here is consistency, which matters far more than the duration. A mere 5 minutes every single morning will significantly outperform an hour-long session once on a Sunday. To summarize, for type A, you possess powerful immune resilience, but this comes with an elevated cardiovascular risk, primarily driven by a stress hormone that your blood type intrinsically keeps chronically elevated. Actively and effectively managing that hormone is, without exaggeration, the most important health decision you will make this entire decade. Moving forward, we arrive at type B, which can be described as the blood type that conventional medicine arguably understands the least, and that mainstream wellness culture, in its often simplistic generalizations, handles the worst. Type B is believed to have emerged much later in human history, primarily among nomadic populations who traversed the immense and varied interior landscapes of Central Asia and the towering Himalayas. These were groups of people who were in a perpetual state of adaptation, constantly confronting new and diverse food environments, dramatically shifting climates, and novel infectious pressures. The immune system that developed in type B individuals is genuinely remarkable for its profound metabolic flexibility. Type B individuals possess an exceptional physiological capacity to efficiently process an incredibly wide variety of proteins, fats, and carbohydrates without eliciting the significant inflammatory friction that other blood types sometimes produce in response to marked dietary variation. This inherent adaptability is a tangible biological reality, and in the grand tapestry of human evolution, it represented an immensely profound advantage for survival and thriving. However, here lies a significant clinical problem that many type B individuals over the age of 55 are unwittingly carrying, often without any conscious awareness. Type B carries a distinct and, as yet, not fully understood immune signaling profile. What the burgeoning research consistently demonstrates is that type B individuals appear to possess a broadly adaptive immune response, one that processes an extensive array of dietary and environmental inputs in a fundamentally different manner than other blood types. Studies have consistently confirmed that type B individuals have a measurably distinct gut microbiome composition, which undoubtedly plays a role in their unique metabolic processing. Critically, these studies also suggest that certain highly inflammatory dietary triggers, specifically refined seed oils, ultra-processed foods laden with artificial ingredients, and high fructose corn syrup, appear to generate stronger and more pervasive systemic inflammatory responses in type B individuals compared to other blood types. The broader autoimmune landscape across all blood types is still an intensely active area of scientific inquiry, and the findings thus far are undeniably complex and multifaceted. Nevertheless, what is unequivocally clear from the available evidence is that maintaining your inflammatory baseline at a consistently low level through a carefully chosen diet, regular and appropriate movement, and consistent monitoring of your C-reactive protein, CRP, levels represents the most evidence-backed and critical protocol for type B longevity. If you are type B and have been experiencing or managing these kinds of subtle, persistent symptoms through lifestyle adjustments alone, perhaps dismissing them simply as just getting older, it is absolutely worthwhile to engage in a direct and candid conversation with your physician about the possibility of autoimmune screening. Early detection of autoimmune conditions can dramatically alter the treatment trajectory and significantly improve long-term outcomes. There is a second, highly specific issue for type B individuals in the context of modern life. The contemporary food supply, characterized by its abundance of highly processed items, effectively presents a complex calibration problem for your intrinsically adaptive immune system. Refined seed oils, ultra-processed foods, and high fructose corn syrup do not merely represent empty nutrition. For type B individuals, accumulating research powerfully points to these dietary inputs as particularly potent triggers of systemic, low-grade inflammation, the insidious kind that subtly runs below the surface of conscious awareness for many years, progressively distorting immune precision and leading to chronic health issues. Your C-reactive protein, CRP level, a readily available and standard inflammatory marker found on a routine blood panel, should be meticulously monitored at least annually. A consistent CRP reading above 1 milligram per liter in the absence of an obvious acute infection or injury serves as a meaningful and urgent signal. It indicates that your immune system is operating in a chronically activated, low-grade inflammatory state, and you must diligently identify and address the underlying triggers before this chronic inflammation escalates and finds you in the form of a more serious health condition. Regarding exercise, type B physiology typically responds most optimally to sustained, moderate intensity movement rather than repeated bursts of high-intensity exertion. Activities such as cycling, swimming, hiking, and consistent, purposeful walking will protect your inflammatory baseline far more effectively than intense interval training regimens, which can generate sharp and counterproductive spikes in inflammatory markers during the recovery phase. To summarize for type B, you are endowed with the most metabolically adaptable blood type on the planet. If you actively work to keep your immune system precisely calibrated through informed lifestyle choices, it will serve as one of your greatest biological assets. However, if you allow it to run unchecked and constantly stimulated by inappropriate modern inputs, it can regrettably transform into one of your most serious vulnerabilities. We now turn our attention to type AB, the youngest blood type in the entire tapestry of human history. Its emergence is a relatively recent phenomenon, in evolutionary terms, occurring when populations carrying both type A and type B antigens began to mix and intermarry on a significant scale. Due to this unique dual inheritance, type AB individuals possess a genuinely unusual and complex immunological profile. On one hand, type AB inherited the remarkable immune tolerance tendencies from both its parent blood types, A and B. This translates into type AB individuals exhibiting notably lower inflammatory responses to certain environmental antigens, which in turn leads to a meaningfully reduced risk of developing some gastrointestinal cancers and specific gastric pathologies when compared to other blood types. This aspect represents a clear biological advantage. However, here is where I must urge you to pay particularly close attention, because what type AB individuals gained in broad immune tolerance, they appear to carry a tangible cost in terms of neurological vulnerability, a susceptibility that scientific research has made increasingly difficult to ignore. Type AB individuals consistently exhibit a statistically elevated risk of cognitive decline, encompassing conditions such as vascular dementia when compared to type O individuals. The underlying mechanism for this heightened risk is fundamentally cerebrovascular. Type AB blood inherits elevated coagulation factors from its A component, which, when combined with the complex cardiovascular antigen profile inherent to AB blood, creates a unique set of challenges. Over the course of decades, this combination can lead to subtle but cumulative changes in blood flow, particularly through the brain's smallest capillaries, the delicate microvessels that are crucial for servicing the regions most responsible for memory consolidation, efficient processing speed, and executive function. These are not typically dramatic, acute blockages that would manifest as sudden strokes. Rather, they are microscopic, gradual alterations in the efficiency of blood perfusion across neural tissue. Most individuals would never consciously perceive these subtle changes until their cumulative effect has been quietly building for 15 or even 20 years, finally manifesting as noticeable cognitive impairments. This profound understanding is precisely why, for type AB individuals, the ongoing health of their cardiovascular system and the long-term health of their brain are not two separate or distinct conversations. They are, in essence, one and the same. Every single intervention aimed at protecting your arterial health, meticulous blood pressure control, vigilant blood glucose management, consistent monitoring of cholesterol and triglyceride levels, is simultaneously and directly protecting your cognitive longevity. Furthermore, docosahexaenoic acid, DHA, the crucial long-chain omega-3 fatty acid found abundantly in fatty fish such as salmon, sardines, and mackerel, plays an extraordinarily vital role for type AB individuals. DHA is directly incorporated into the cell membranes of neurons, where it is instrumental in maintaining membrane fluidity and significantly reducing the neuroinflammatory signaling that is known to accelerate small vessel disease in the brain. Consuming 2 servings of fatty fish per week or discussing a high-quality fish oil supplement with your doctor is not merely an optional dietary choice for type AB individuals. It represents targeted neuroprotection, grounded firmly in your specific biological makeup. Sleep is the other non-negotiable pillar of health for type AB individuals. During the crucial stages of deep sleep, your brain's glymphatic system, its remarkably efficient internal waste clearance network, actively flushes out accumulated metabolic byproducts, including the amyloid proteins that are strongly associated with neurodegeneration and cognitive decline. Consistently sleeping for less than 6 hours per night meaningfully impairs this vital cleansing process. For type AB individuals, chronic sleep restriction is not merely a cause of fatigue. It is actively accelerating the very biological processes to which your blood type already makes you more vulnerable. Prioritizing 7 to 8 hours of quality sleep every single night is, without hyperbole, your single most powerful daily intervention for long-term brain health. To summarize, for type AB, you possess impressive immune tolerance, but your brain demands deliberate, consistent, and long-term defense, a commitment that must begin now, not merely at the age of 70. Before we draw this comprehensive discussion to a close, there remains one additional, incredibly significant variable that is almost universally excluded from these crucial conversations, yet its impact is undeniable. This is the elusive plus or minus sign affixed to the end of your blood type designation, the Rh factor, denoting Rh positive or Rh negative. Approximately 85% of people are Rh positive, meaning their red blood cells carry the Rh antigen on their surface. The remaining 15% are Rh negative, and it is crucial to understand that this difference is far from cosmetically minor. It represents a distinct biological distinction. Rh-negative individuals appear to possess a modestly different cytokine signaling profile, meaning the intricate chemical language your immune system employs to communicate and regulate its responses is calibrated in a unique manner. Research is still actively establishing the full clinical significance and implications of this distinction. However, what is increasingly emerging from scientific inquiry suggests that Rh-negative individuals may possess a heightened sensitivity to certain inflammatory triggers. This means that regardless of your primary blood type letter, O, A, B, or AB, if you are Rh negative and actively manage any chronic inflammatory condition, the anti-inflammatory protocols and lifestyle recommendations I have meticulously outlined today are even more relevant and should be implemented with an even greater degree of rigor and consistency. Furthermore, for women who are Rh negative, if you are currently pregnant or are contemplating becoming pregnant and there is a possibility that your partner or baby may be Rh positive, this situation presents a medically critical conversation that must be initiated with your obstetrician immediately. Rh incompatibility during pregnancy is a serious condition, but it is entirely manageable with appropriate and timely medical intervention. It crucially requires that intervention, and it demands it proactively, not reactively. Therefore, it is imperative to know your complete blood type, both the letter designation and the Rh sign. Ensure your physician has both recorded accurately in your medical history. Now allow me to articulate what I believe is the single most important message I will convey to you today, and it is a truth that most blood type focused content entirely avoids. While the statistics are real, the documented risk elevations are robust, and the underlying biological mechanisms are genuinely significant and well established. These factors are emphatically not your immutable destiny. I have personally witnessed type AB patients in their mid-70s exhibiting sharper cognitive function than colleagues 15 years their junior. This exceptional outcome was not because their inherent genetic risk profile was somehow magically different or absent. It was because they possessed a clear understanding of the specific biological predispositions and challenges their bodies were inherently working against, and crucially, they consciously and diligently constructed their daily lives around actively addressing those challenges. They consistently prioritized 8 hours of restorative sleep every single night. They incorporated 2 servings of fatty fish into their diet every week without fail. They maintained their blood pressure meticulously below 120/80, not just when they remembered during a checkup, but consistently as a daily discipline. And critically, they continued to engage their minds by genuinely learning new and challenging things, not through passive, casual scrolling on digital devices, but through real, effortful, cognitive engagement. Their statistical risk was still inherently present. The biological profile still applied to them. They simply made the conscious, empowering choice to meet that risk directly and proactively, rather than allowing it to accumulate quietly and insidiously in the background, unchecked and ignored. The chasm that exists between genetic predisposition and the actual lived health outcome is not merely small, it is in fact enormous. And that vast, expansive gap is filled entirely by the cumulative weight of choices made consistently, day after day, year after year. That gap is precisely where your decisions reside, where your agency truly lies. Your blood type is not a predetermined sentence. It is, more accurately, a highly detailed and personalized map. And a map, no matter how precise or profound, is only useful if you are willing to genuinely look at it, understand its contours, and then actively navigate by its guidance. I invite you now to share: what is your blood type, and does the profile I have described today resonate with what you have actually been experiencing in your own health over the past few years? Your insights in the comments are invaluable, as I genuinely read every single one, and the consistent themes that emerge within this community profoundly shape the topics and explorations I choose to cover next. If you found this information truly useful and enlightening, there is another deeply insightful video linked in the description below, where I delve into the 3 most commonly missed root causes of persistent fatigue and chronically high blood pressure in men and women over 55, debilitating conditions that are remarkably addressable when identified early, yet almost invariably mismanaged when they are overlooked or dismissed. Please take exceptionally good care of yourself. You have carried this incredible body for a long time. It is profoundly worth understanding precisely how it truly works.